Hi everyone, Dr. Annette here, and I just want to do a little quick video about iron and in particular ferritin levels. I've noticed lately that, well, one, I'm getting a lot of questions of many of my female patients freaking out about their ferritin levels and that it may be the root of all evil of things that are going on. So I think it's important to have a discussion about the bigger picture, which is looking at iron, looking at total iron binding capacity, looking at the saturation, transferrin saturation rate, and ferritin. And then when you really need to know a little bit more, then we would actually look at a complete blood count as well. But I get a lot of, this is, clearly the reason someone's hair is falling out. I had someone tell me the other day that she was told that her ferritin was low and that's why she was passing out. And I just want to say, no, that is absolutely was not the reason why. But I will, when we are anemic, and again, you've got to look at multiple levels. So just the fact that your ferritin is low is not the standalone reason to say that someone is anemic. But if someone truly is anemic, then of course fatigue, also feeling like a lack of oxygen. So sometimes this turns into more like symptoms of palpitation, tachycardia, and of course there can be hair loss as a result of anemia, but we want to look at, again, what are all the things that are going on. So I did make a little cheat sheet because it was too much to write on a whiteboard, and obviously I don't want to get any of this wrong. So first off, we want to think about what I just said. So many times we will look at serum iron. So total serum iron is reflecting our iron that's bound to a serum protein. But generally when we're looking at iron in the blood, about 70% of this is in the form of hemoglobin, and then the rest of it's going to be found in the liver, the spleen, and in our bone marrow, right? Now, when we want to think of if someone has iron deficiency or excess, right? So there's two sides of this coin. You can be too low and you can be too high, and they can kind of have their own meanings. But if we want to really understand if someone's anemic, like I said, we got to look at all these different values. So for instance, probably, the most obvious picture would be low serum iron, elevated total iron binding capacity, a low saturation, and then low ferritin. Then you take it one step further, you look at someone's hemoglobin and hematocrit, but in particular hemoglobin. That would also compound the level of anemia. And then we also have other markers that we look in a CBC, such as MCV, MCH, MCHCs, and these would be some other markers as well. Now, if you have low iron, it's important to understand, well, what could be at play here? Like what could cause the low iron? Well, one of the big reasons I think for a lot of individuals comes back to malabsorption or poor digestion. See, it takes really strong stomach acid to be able to absorb iron. Honestly, I think this is why a lot of times when people take what I consider not a great source of iron, they're encouraged to take it on an empty stomach and away from everything else because there's nothing to compete with. So you just got that stomach acid, and somehow that's gonna help elevate it. But a lot of times if someone is under high stress, this can result in lower stomach acid. If they have been on an antacid or currently on an antacid that reduces their stomach acid, which we already know that those alone can result in anemia, B12 deficiencies, and so on and so forth. But the other thing about it could also be what I see a lot in the female patients that are still having their menstrual cycle is really heavy periods. And for some of them, they never really get quite on top of it. So this could be more problematic in perimenopause leading into menopause, but these really heavy flow periods, unrelenting, and they're not restoring or replenishing, could be maybe a result of fibroids, something like that. That could be the other factor that comes into play. And it's been an interesting correlation that I've noticed is that when she's anemic, it seems that she bleeds heavier as well. So it really becomes this vicious cycle. And on a side note, we do see relative anemia in women that are pregnant. I don't necessarily think that that's okay, but it is a more common finding. Now, what about ferritin? So ferritin is is our, it's the storage. So it's the level of iron that is stored in the body. And that range is anywhere from like 10 to 120, 130. That is the range, because one, too high is too high, and then that can be problematic in its own way. But when we're really looking at alerts, it's when in women, if that ferritin level gets below 8. So not only is she, and usually what you're going to see is low serum iron. So there's going to be some other factors, and it's not just going to be the ferritin. I also think sometimes when ferritin isn't super high, well, she's just not, she doesn't have the excess to store. Her body is using, and there's no extra to store out there. But some of our recent, I would say, in the functional realm, are telling women that it's got to be 70 to 100. And if it's, and some are just saying straight up, it's got to be 100. And if it's not there, well, that's why you're having all these problems. And honestly, that's simply not true, because it's not, even when you look at labs, it's not just one lab number. You've got to look at the full picture. And that's why I think it's really important when we're looking at ferritin. Like, yeah, could we desire it to be close to 70? Absolutely. But just because yours is a 15 or 20 doesn't mean that that's all the problems that you're having. Now, I recently had a patient where I knew she was having heavy periods, was trying to get to do the test, and she had all the signs of anemia: low hemoglobin, low hematocrit, all the markers in the CBC. Her total iron was 16. Iron binding capacity was over 400. So just long story short, and the ferritin was low, I think like at a 5. Yes, that's anemia. That is some serious, issues going on, and it's certainly reflected in her getting out of breath, tachycardia, and so forth. So when we're looking at it, you got to remember that you've got to look at all the pictures and not just the ferritin. Like the iron binding capacity, well, typically this elevates when there's low iron. It also will elevate with low ferritin, and then low saturation. Sometimes it doesn't all match up, and because we're really looking at the liver, maybe sometimes the work is to go back to the liver, and it's not about just blasting someone with a bunch of poor quality, as I would say, iron ferrous sulfate. Ferrous sulfate is, that kind of was redundant, but ferrous sulfate is the more common one. Okay, so with that, now what do we do? First off is, don't hyper focus on the ferritin as a standalone. And if your physician is not looking at all these other markers, then you need to go somewhere else. Because if you're just making decisions based on one number, that is not okay. If you are not having heavy periods and yet you look very anemic, then this could be a concern for maybe there is some microscopic bleeding possibly going on somewhere where there is this loss of blood. I think that is important to figure out. We want to make sure that our gut is in good health. We want to make sure we also have the cofactors for iron absorption. Vitamin C is a big one. Now, in what I do, I generally use either iron that is a chelated form of iron, which is highly absorbable and highly bioavailable, or it has a lot of liver in it, because liver is probably one of our ultimate sources of iron, as well as B vitamins. And what I have found is that when I do that, it doesn't matter when they take it. Like, they don't have to take it on an empty stomach, because of the high quality, and that it has all the cofactors naturally with it. If someone is struggling, or you're struggling with digestion, maybe you've been on an antacid, maybe you have trouble going to the bathroom, which is a good sign of low stomach acid, take some betaine hydrochloric acid when you take your iron supplement. But I think the big deal there is, one, making sure that there's not something serious to rule out. Better quality, higher quality, is going to bring those numbers up much, much faster without making you feel bad. And then, of course, making sure the gut integrity is there. Other things to think of, if you're doing this through diet, you could do some liver, you could do some mushrooms. This is going to have vitamin C, it's going to have immune support in it. Lots of dark leafy greens, those are going to provide other B vitamins, a little bit of iron, a little bit of vitamin C, and other minerals. So there's a lot of ways that we can help ourselves with this. But the final note on that is that your body is more than just one number, right? So it's not just the ferritin, it's the full picture. And if you need help understanding that, reach out to your functional practitioner or reach out to me at Endocrine Wellness.